Hi, I'm Dr. David Hill, and today we're going to talk about how to treat infant fever. Now, infant fever is something that is really frightening to a lot of parents, and depending on the age of the infant and the height of the fever, perhaps it should be. So let's take it by age, first of all. The most critical time is in the first 1 month of life. Any baby who has a fever in the first month of life, and what do I mean by a fever? I mean a rectal temperature of 100.4 degrees or greater. I would encourage you, if you do have an infant, to go ahead and buy an inexpensive rectal thermometer and use it. You just have to put it a little way into the rectum, into the bottom, to get a sense of the real temperature of the baby. You're almost certainly not going to hurt that baby. A lot of people are shy about it, but don't be shy. You're not going to hurt the baby. You are going to get an accurate temperature. And when somebody calls me in the middle of the night, that's the temperature I really want to know. Now, if you have a thermometer under the armpit and it's over about 99.5, that's also somewhat concerning. If you have a little strip that goes on the forehead, it's almost useless. However, there are some more sophisticated electronic forehead thermometers that may provide a very good reading. Likewise, the ear thermometers, not really good for newborns. I wouldn't recommend using those. So, you've got a newborn, first month of life, temperature greater than 100.4 degrees. You want to have that child in front of a medical provider immediately, in the emergency room, if necessary, in that child's doctor's office, if possible. But that child needs care now. That is never okay. That's really kind of the case for the first 3 months of life. From the first 12 weeks, really, any fever over 100.4 needs to be evaluated, and it needs to be evaluated pretty quickly. Why? Because that can be a sign of a very serious infection in the bloodstream, and the earlier you treat that infection, the likelier it is the baby is going to do okay. Another temperature that concerns me at any age in a baby is 100.4 degrees rectal. Anything over 104 suggests you're probably not looking at a plain old everyday garden variety virus. Could be influenza, still could be a virus, but you've got my attention now. So if it's over 104, the child really should be seen within the first 24 hours of that fever occurring. If it's over 105, again, the fever's not going to hurt the child, but I want to know what's causing the fever. So that child needs to be looking at a doctor within an hour or two of getting that temperature. Now, what's not scary about fevers? Fevers will not hurt children. People believe the brain is going to fry, they're going to get some sort of permanent brain damage. A child is incapable of generating a fever on his or her own that is high enough to do that. Now, I said on his or her own. If you leave a child closed in a car, when the sun is shining in and the temperature of the car goes up to 106 or 107, the temperature of the child is going to go up that high, and that may be very dangerous indeed. Likewise, older children, athletes who are exercising without adequate water supplies or running on very hot days may develop actually a dangerous temperature. But your child gets sick, develops a fever, the fever's not going to be the thing that hurts them. So, knowing that, we want to make sure that whatever we do for the child is not going to hurt the child more than the fever. You can use Tylenol starting at about 2 to 3 months of age. You'll want to talk to the child's doctor for dosing guidelines because it depends on the child's weight. Starting at 6 months of age, you can also use ibuprofen, which is what's in Advil or Motrin. Don't combine these with other cold preparations. If it says cough and cold or, runny nose or allergy prep, don't give that stuff. Babies do not need that, but you may want to give something to make them feel a little bit more comfortable. Now, if the child is very uncomfortable with fever or you're worried, you can put the child in a tepid bath. Notice I said tepid, not cold. A cold bath is going to be uncomfortable and unnecessary, but some lukewarm water may add to the child's comfort, may bring the fever down a little sooner. That said, you never have to do that because the fever, again, is not going to hurt the child. Now, people say, what about febrile seizures? Will the child get a seizure as a result of the fever? That can happen occasionally. It's a relatively common occurrence in children between the ages of 6 months and 6 years of age to get a seizure when a fever occurs. In most cases, these seizures are completely benign. They look scary if you're the parent, but they don't usually harm the child. A fever seizure that goes on more than 5 minutes, however, is unusual, and if that's going on, you do want to call EMS and get some help in there. So, talking about what to do for an infant with a fever, I'm Dr. David Hill.